Empowering the patients is the new goal we have as, psycho-oncologists, surgeons, physicians, researchers working on oncology, because we are going in the direction of the right answer to the right patients, to that particular person, to the personalized medicine. So if we have a personalized medicine and we need to give an answer to a particular person, this means that we have to empower the patient, engage the patients, and having a great part in taking decisions. So we need to become counselor of a person that, since is empowered, can choose on his or her life. What we are developing is contribute in being informed as patients, being informed, know exactly things on his or her pathology, and overall taking decisions, giving to the patients free for options, not too many, but enough to choose how to go on, for the quality of life and the respect of the beliefs and the values of that person. There is a research we did in different countries in Europe, UK, France, Germany, Spain and Italy. And what we saw is that there are many unexpected needs and unmet needs of patients when and where the patients are not empowered. There is a big difference between patients empowered and not. We did a research in 5 different countries in Europe: Spain, Italy, UK, France and Germany. And what we saw is that if the patients are empowered, they better behave with their life and their quality of life in the sense of managing better their cancer. So, for example, they have less anxiety, less anger, they know how to choose between different options we give to them. And they have better habits, they eat healthy, they move, they do good things. They enlarge their communities, and they don't stay only in the family, just talking with their general practitioners, but they are able to have a social life and go back to work and have friends and think into the future, behaving better. During this forum, the aim was to create an agenda for Italy in the specific country, because in Italy we have many problems on the side of the psycho-oncologists, for example, because we know that there is a psycho-oncologist just in the breast unit and nowhere else. And this is true for some centers of excellence and not for many, and not for all overall. And even in the relation between physicians and patients, we have problems, because we don't have in the instruction of, so at the university, a course for every student to develop a good relation with patients. So we have doctors that very often, this is one of the results of the unexpected and unmet needs of patients, what they say. You have physicians that ask questions or listen here to the patients, but they don't listen. They don't listen to the patients. They listen just to give an answer and not listen to understand the need of the patients. So even on the side of the instructions, we are trying to do some specific things at universities to have better physicians in the future, for example. On the side of the clinical institute, to have more psychologists helping people in taking decisions, so consultancy for the patients and for their families, and this in Italy. At the European level, we are even acting on an agenda with the European Commissions, with the different countries to share decisions in every country and to have just one policy. So acting even at the politicians' level. It was very interesting because we have many differences between the different countries. For example, in Italy we have chemotherapies for every patient. This is not true in Romania, for example, that is even Europe. So the accessibility to the chemotherapy is a big issue that we have. But even the support we can give to the patients, even the fact that the organization must take care of the patients and put the patients at the center. And we are doing a big action, even at the political level, to have a good answer for the patients. I think that this meeting was really successful. We had more than 600 people involved. I have to say that many people at different levels, so from on the side of physicians and on the side of patients, on side of institutions and on side of political and pharma, and different organizations were involved. So the big success, I think, will continue with a second edition.